All right, folks, we are going to talk about dermal or capillary punctures. This is chapter 10 in your textbook. We're going to talk about why dermal puncture may be used instead of venipuncture for some patients, selecting appropriate dermal sites and equipment, and how to perform a successful dermal puncture. So venipuncture tends to be more difficult in infants and children because their veins are smaller. They can't withstand that vacuum pressure from the evacuated tubes. And it's also difficult to get them to sit still. These are all things we've talked about. Sometimes adults too with different issues with some smaller veins or maybe some other problems that make it more difficult to find these veins. Dermal is the preferred blood collection technique for infants and small children, and it may be used as an alternate method for adults for whom the venipuncture procedure is too difficult. Again, if they have some sort of issue or condition that makes their veins a little more difficult to find and get to. They may also be elderly or obese, severely burned, or just difficult to locate veins. For certain tests, it's important to keep in mind that dermal testing is not appropriate. And that would be things like blood cultures or ESR, which is the erythrocyte sedimentation rate. Part of this is due to the volume of blood needed, so you cannot do a dermal or a capillary puncture. Dermal puncture, like the name says, dermal or capillary, they're interchangeable, is a specimen that's obtained from the capillaries. Because it's obtained from the capillaries, dermal puncture specimens are actually a mixture of venous and arterial blood. Oh, I don't know if that, sorry if that showed up on your screen. The drawback, of course, to dermal punctures is the small amount of blood that you can get. So if you needed to, for example, if something happened to the first specimen or you need to rerun the lab for some reason, you're not usually going to have enough blood from a dermal puncture to rerun a test without having to restick. All right, so preparing for a dermal puncture, they're basically the steps to prepare to do a dermal puncture are the same as venipuncture. The main difference is the site selection and the equipment. So we're going to talk about that. To select a site for a dermal puncture, the skin, you need to be warm, pink, free from scars, rashes, bruise, or edema. Edema can, when someone has too much fluid in the area, that edema can actually alter test results. Bruises, painful, scars, it's not a good place to go. You don't want to go in the same place over and over again. Sites to consider for children and adults, usually the distal regions of the middle or ring fingers is appropriate. For infants, the medial or lateral region of the plantar surface of the heel is appropriate. So you can see that on these two images. On rare instances, and only with approval from a provider or licensed practitioner, could a dermal be done on the toe or earlobe, okay? You wanna make sure that you don't, well, I'll tell you the reason we don't use the thumb or the pointer finger is because usually the skin on those fingers tend to be more thick and calloused. And we don't use the little finger, the pinky finger, because that one is so much closer to the bone that we risk puncturing bone. Which if we puncture the bone, we risk causing an infection in the bone called osteomyelitis. You also don't want to use the tips of the finger. Again, look at that image there, you're going at the side. You always want to puncture across the grain or across the lines of the fingertips, not within the same line of the fingertips. It's also good to go on the non-dominant hand, and that's partially because of comfort and just like thickness and callousness of the fingers. In infants, you definitely don't want to use the arch of the foot, the back of the heel, or the plantar area. You want to stay away from bone. If the bone is punctured, like mentioned with anyone, but if the bone is punctured on the infant's heel, this can cause infection and osteomyelitis. And this is actually considered negligence and malpractice as well. So pre-warming the site for capillary punctures can often be really beneficial just to get that increased blood flow. Let's see. And a lot of facilities will have certain, like this you see here, it will show you the puncture depth that you need to do and the site at which you need to do it, especially when we're talking about the different ages, right? Premature versus infant, child, and adult. All right, so equipment needed. Before performing a dermal puncture, just like a venipuncture, you want to make sure you gather all of your equipment and supplies. Equipment needed for the dermal, like we mentioned, is the same as with venipuncture, except for the collection device and the puncture device, excuse me, in the collection containers. We're going to be using those micro collection tubes or micro specimen containers. So as a reminder, what you're going to need for equipment is going to be your requisition slip or order, gloves, alcohol pads, gauze, bandages. You want to have them on hand. It's not always, depends on the finger stick, not always necessary. Remember, capillaries can constrict and that blood flow can stop pretty quickly, but you might need it. Permanent marker or pen, sharps container, the label, a capillary puncture device, so like a lancet, and the microspecimen containers. The microspecimen containers, like we talked about in the blood specimen equipment lecture, vary in size and color, and they're chosen depending on the puncture devices are chosen based on age and size of the patient. So performing, oh, look at that tiny little heel warmer, so cute. So collecting the specimen. When a dermal puncture is performed, remember that's just a cut into the dermal, which is the skin surface. So remember to make a cut in that direction against the grain of the fingerprint lines. This actually makes the blood flow and the drop formation better than if you had done it in the other direction. And that's going to be really helpful when you're needing to collect a specimen and get a good specimen. So you want to clean, let's talk about the finger. You want to clean the finger with an alcohol pad and allow it to dry completely. You're going to apply slight pressure and then puncture the site with your device. The spring-loaded devices that people use often for glucose checking are often not large enough when you need to fill one of these micro collection tubes. So there is a difference there, right? In the lancet used for glucose checking and lancets used for collecting the specimen here. So always wipe away the first drop. We talked about that in the previous lecture. I think I mentioned, or maybe I didn't mention, that's because this first drop contains some of that interstitial fluid, which is just the fluid that surrounds all of our cells. And if you get that interstitial fluid in there from that first drop, it's going to alter the test results. So you wipe away that first drop. You wait for the second drop to be formed. And then if you're using a micro collection container, you hold that up to the end of the drop of blood, and gravity or capillary action will just let that go right into the container. To do it correctly, you need those drops of blood to just flow on their own. You don't want to be what you might have heard called milking the finger to get the blood out. And that's kind of squeezing and squeezing and squeezing to try and push it out. It doesn't actually enhance blood flow, and it can contaminate the specimen with interstitial fluid. You also don't want to scrape the container because that can also render the specimen a little bit. You can gently squeeze and release, allowing time for the capillaries to refill with blood. So gently squeeze and release is okay to do. It's going to help. I know I'm doing this so you can see it, but it's good to keep the site below the level of the heart, allowing gravity to help as well. And just like the evacuated tubes, most micro collection containers will have a fill line, and a lot of them will have an overfill line and an underfilled line. You want to get in between there to get your ideal amount. And remember, these also need to be inverted and drawn in their appropriate order. And as a reminder, the order of draw for the micro collection tubes and the dermal punctures is slightly different than the order of draw for the venipuncture and the evacuated tube. So make sure you know the difference between the evacuated tubes with venipuncture order of draw and the micro collection containers and the dermal order of draw. As a reminder, order of draw for the micro collection tubes is the EDTA, which is lavender or pink, heparin, which is green, sodium fluoride, which is gray, and then the non-additive red or serum separator gold. Some complications that can arise, oh, there it is. Some complications that can arise from dermal puncture is basically infection or pain, like we've talked about. You've got osteomyelitis, you've got pain if you puncture the same site more than once. You don't want to hit that bone. You can also, along with osteomyelitis, which is the infection and inflammation of the bone, you can get osteochondritis, which is affecting the bone and the cartilage. So you do have to make sure you're choosing the appropriate equipment, the depth, the size for what lab you're doing and what patient you're working with. After the dermal or capillary puncture, of course, like I already mentioned, you want to make sure you're inverting your specimens. You want to dispose of any sharps into the sharps container. You want to label the containers and observe them for any special handling instructions that they may have. Put them in your transport bag and have them ready for transport to the lab. You want to also, with these individuals, make sure that the bleeding has stopped before you leave the room, and dispose of all of your supplies appropriately. So as a quick review, and I think that's it, for collecting the dermal specimen, I'm just going to go through the steps one more time. You want to, after performing the dermal puncture, you want to wipe that first drop of blood. There again, if you're using a capillary tube, that's a tiny little tubes, you're going to hold the tube horizontally to touch the end of the tube to the drop of blood to fill it, and it'll fill by capillary action, so it'll just happen on its own. If you're using the micro collection containers, you want to make sure, again, follow the order of draw, and this is when you want to allow those free flowing drops of blood to just enter the device without milking the finger and without doing any scraping. If the micro collection device contains an additive, you also want to make sure to tap the container on a surface gently with each drop of blood. So you get a drop of blood, give it just a gentle little tap on a surface, and that helps to mix the blood with the anticoagulant additive. And that is really important, and I forgot to mention that earlier on. So again, if the micro collection container has an additive, after each drop of blood, give the tube a gentle tap on a hard surface to help with mixing. Again, you want to make sure that you collect the blood to the fill line without going over it or under it. So right in between is good. When you're done, you're going to tap the micro collection container or seal the capillary tube. You're going to invert it. You're going to dispose of your sharps, label your micro containers, check the puncture site, and make sure that the patient is not bleeding, and apply bandages as appropriate. So that's it. It's very similar, again, to venipuncture. So really it's the steps before, during, and after a venipuncture, just with a few exceptions with the device you're using and the actual collection tubes as well. So if you have any questions on that, let us know. Otherwise, get your hands on it in lab and practice, practice, practice. Thank you.